Welcome, viewers, to Morning Grounds, Morning Rounds, which is our series where we explore issues with leaders, faculty, staff, so that we can delve into some of the organizational initiatives, some of the key activities that we're doing here at Stony Brook Medicine. Today, we're going to be talking about organizational culture, and we're very fortunate to have with us Carol Gomes, the CEO of Stony Brook University Hospital and the COO of Stony Brook Medicine. Talk to me a little bit about what does the word culture mean to you and why is it so important for Stony Brook Medicine?
Culture has always been very important to me. I've always been fascinated with different types of organizational cultures. Specifically, when I think about Stony Brook Medicine, though, I think about our foundational values of iCARE. And when I think about culture, I think it's synonymous with how we behave toward one another in an organization, whether it's between staff, faculty, or even with our patients and visitors. And I just view it as a shared set of beliefs or values or behaviors that we find appropriate for our organization. And, you know, I know that many people who are watching this who are employees and faculty here know that iCARE is our foundational focus on values. And so we focus on integrity, compassion, accountability, respect, and excellence. And another facet of culture that I think is so important is bringing that positive culture to an organization. And I really believe that starts with the leadership demonstrating and role modeling those values. I believe that when organizations have leaders that believe in those values, that behave and live those values every day within the organization and behave accordingly, it creates a high-performing team. And I can tell you, I feel at Stony Brook that we are a high-performing and very dynamic team. And I think that's what I think of when I think of culture is our values and that foundation in how we behave within the organization and treat one another and our patients, and that movement toward performance improvement and high-performing organizations.
Great. I agree. We are a high-performing team. And I really think those iCARE values are so important and fundamental to everything that we do. I know that you have implemented a number of different interventions or activities to really try to engage employees and staff and get them engaged in the culture, such as red sneaker rounds, for example. And also at the same time, we have some of these external recognition, such as the Becker's Healthcare identifying us as a top place to work, the Joint Commission Health Equity Certification. Tell me a little bit about how those two things fit in with building and sustaining an organizational culture.
Yeah, sure. Well, first of all, the external recognition is extremely important. It demonstrates our level of commitment to quality, safety, the patient experience, and really our tripartite mission relating to academics, research, and clinical care. But in terms of our culture, again, it goes back to that high level of performance and the ability to be a leader, not only locally or in our state, but in the country. And I believe that those external recognitions, whether it's Becker's as an organization that is a top place to work, or we've also improved our ranking for Vizient by 23 rankings, which is really considerable when you think about all the other organizations that improve at a faster rate. So again, it stems back to that positive work culture. When people have pride in what they do and they come to work every day dedicated to our mission and why we exist here at Stony Brook Medicine, it really translates into those activities. Whether it's, again, a top place to work and that team dynamic and the ability to perform, or all working together in terms of performance improvement initiatives, which also is a team sport. We all know that. And those Vizient rankings of improvement, that is fundamentally the entire organization working together and rowing in the same direction together to achieve those goals. So, you know, it really all comes together. It's about that positive attitude coming to work. I know when I come to work and I walk through the doors in the morning, I'm really excited to be here, and I feel proud that I'm part of Stony Brook, and I wear my logo proudly. And I think that many others who work here have that same sense of pride. And I believe that when people come to work every day, they want to do the right thing, and they want to provide the best care. And if you're not a direct patient care provider, whatever it is that you're doing to contribute to the care of those patients is being done at the utmost level of performance. So I really do believe in that level of positivity. And there's also, and I know you know this, there is data out there that suggests that there's a high correlation between staff and employees who are fully engaged and patient engagement.
Right.
So, and we see that. We
do. And I think you're right. I can tell that you're very proud to wear that Stony Brook logo when you walk through the door, as am I. Mm-hmm. So, it's interesting. I agree with you. I think that some of the external validation is wonderful, but it really is just a reflection of how engaged and how much people really gain satisfaction out of working here and doing the work that we do every day.
Okay.
So I think that's really important. What are some of the things that help you keep the staff and the faculty engaged? How do they get to know that the feedback that they're giving you is incorporated?
There are numerous ways. The two that come to the top of mind, one is performance improvement and our quality improvement initiatives. Obviously, everyone on the front line needs to be engaged. And when you think about our quality program, we have metrics that we review at the governing body level with the president of the university, who is our governing body, and our senior leadership team. But those data cascade to the service line level and then to the unit level. And we have our high reliability units where that data is literally posted right on the unit, and any member of the staff can review the data and understand where we are, where we aspire to be, and how we close that gap together as a team. And so every day right on that front line, there are opportunities for the staff to be completely engaged in those activities. So I would say performance improvement is certainly one way to do that. Another way is through our employee engagement survey. And as you know, another source of pride is that we considerably improved our rankings for employee and faculty engagement as well. And in fact, every question on the survey from 2023 was improved from 2021, which tells you that we're working together, leadership, to ensure transparency, communication, and finding ways to communicate with the team, understand what the needs are of our team and staff. And you mentioned red sneaker rounds before. And so if anyone hasn't seen us, although I believe we've been to virtually every unit, we've done our red sneakers, a number of us from the C-suite, and we basically have visited many of the units, and we've discussed with the team members, anyone who comes into our view when we're on the unit, what could we do to improve how we work together? Are there any barriers that prevent you from being able to do your job every day? And we have some great conversations on the unit, and maybe it's a way to learn things that we otherwise wouldn't have known if we weren't walking around and talking to folks. So, and many times we can fix things on the spot, and then there are some things we need to take back, and it may take a bit longer to accomplish. But it just demonstrates that level of transparency, that openness and communication, so that we can gather that information and be able to hear the staff's voice, hear the faculty's voice, and make change as a result.
Right. I think that's so important. I think when people see leadership listening to their concerns and taking them seriously, that makes them understand in a really fundamental way that we're committed to the welfare of our staff and just as much as we're committed to the welfare of our patients. I think that's really important. I wanted to ask you a little bit about, if you look ahead and think about the future of healthcare over the next 5 years, 10 years, whatever, how do you see, if at all, our culture changing to accommodate some of the changes in how healthcare might be delivered in the future?
That's a really interesting question, particularly because healthcare is so dynamic and it's ever changing. They always say the one constant thing about healthcare is that it's changing, right? And so, I think it's very important, especially in a very competitive environment, that we are adept, agile, have the ability to focus on change management. I think we need to embrace change management. I think we do a good job of that, particularly as we have been one of the first organizations in the country. Actually, we were the 8th to achieve Joint Commission certification for healthcare equity, or focusing on Practice Greenhealth and being really one of the first out front of the pack with academic medical centers to focus on sustainability. So I think that, what the future holds for us is the importance of being adept, agile, and embracing change. And I really believe that our culture is very quickly moving in that direction, if not just about there.
Right. I think that's so important. I think it's hard for people at first blush to make changes because it's threatening. But I think if people see, as I think they do here at Stony Brook Medicine, that when you make a change, it actually results in improvement for our patients, for our staff. And I think that reinforces this virtuous cycle of that change. So I think that's really important.
Since you mentioned that, I think, what's important, in terms of the leaders here is that it's really important to connect the dots for everyone. So, if we have a performance improvement initiative and there's evidence-based practice to suggest that we need to make certain types of changes, you don't just tell people, you need to make that change because I said so.
Right.
That's not the way to do it. But I do believe that the way to do it is to describe why we have to make that change and demonstrate the outcome that it would result in for our patients, for our faculty, because it's more efficient. It provides perhaps a physician with more time to be able to see another patient or do something else besides, being inefficient with their time. So,
right.
I think connecting the dots is something that's what I always use that term is very important.
It makes me think of one of the very first projects that we worked together on, right?
Yes.
Which is a performance improvement. I was working with residents, and of course, they were notoriously resistant to change.
Yes.
But you, I think, really showed them what the value of making a change was, and they were so engaged and so enthusiastic about doing this project, and they themselves became ambassadors for performance improvement to other people in the program. It was a really powerful experience.
Oh, I appreciate that you remember that because I remember it too. And it was one of my first teams that I facilitated an FMEA. It was our first FMEA. And I actually remember the residents.
Yes.
And they became attendings, didn't they?
They did indeed.
Here.
That's right.
Yeah.
So when a new employee joins the organization, how do they learn about the culture that we have here at Stony Brook Medicine? What are the things that help them understand who we are?
Well, we have a few different initiatives. We've been very much focusing on recruitment and retention. And as part of that, we have been modifying the onboarding process. Our human resources team, particularly Colette Brown and Kate Guggenheim, have been very focused on what we can do to inculcate new employees within the organization. And just as you focused on that particular area of culture, we have something called the 90-Day Hooray. And it's a very fun event. It's very uplifting. In fact, Wolfie joins us, which is always fun. I always make sure I get a pic with him.
Love Wolfie.
And so do the new employees. So we basically celebrate their 90 days of working at Stony Brook Medicine. And it's an exciting time. We talk about what it means to be part of Stony Brook Medicine. We talk about our pride and what we are working toward, what we aspire to do with our vision of the organization, and the important role that each and every individual plays to contribute to this high-performing team, and that they are part of this now. So it's a very prideful event, and we also have many other ways to go about inculcating the culture for new employees. We have buddy systems, we have departmental orientation, we have organizational orientation. So there are many facets to this, but the ultimate goal is to retain our team members when they come aboard. And so we want them to feel comfortable. We want them to embrace our positive culture and participate.
Well, Carol, thank you so much for joining me this morning and for sharing some of your thoughts about culture. You and your whole team do such a great job in making sure that this culture permeates every level of our organization.
Thank you.
So, hope you enjoyed this session, and I look forward to seeing you at more in the future. And have a great morning.